Thank you to the program committee for the invitation to present our work today. I have no disclosures. Sexual harassment is a form of discrimination that includes gender harassment, unwanted sexual attention, and sexual coercion. A recent report noted that up to half of U.S. women have experienced sexual harassment at some point in their lives. Sexual harassment experienced in the workplace can have many negative consequences, including a decline in job satisfaction, productivity, or performance. Until recently, much of the conversation about sexual harassment in the workplace has been relegated to private discussions behind closed doors. However, the Me Too and Time's Up movements have shined a spotlight on the pervasive nature of sexual harassment in the media, the business world, and now in science and healthcare. Although there are more female physicians in practice today than ever before, gender disparities continue to plague the field of medicine. The Society of Gynecologic Oncology is a professional organization dedicated to the care of patients with gynecologic malignancies. As of 2019, 51% of its members are women, and that number is steadily growing. Despite the large female representation, gynecologic oncology is not immune from gender disparities. The 2015 SGO practice survey noted that while 22 of male GYN oncologists held the rank of professor, only 11% of their female counterparts held the title. Given that there is little objective data on sexual harassment in gynecologic oncology, the objective of our study was to evaluate perceptions of sexual harassment and gender disparities among physician members of the SGO. To do this, we conducted a survey of the 1,566 US-based physician members of the Society of Gynecologic Oncology. Respondents were asked to provide demographics, their views on gender disparities, and answer questions regarding experience with sexual harassment during training and during their practice, and interactions they had with faculty, nurses, residents, fellows, and other institutional employees. Physician-patient interactions were not included. 402 responses to the survey were received for a response rate of 26%. 63% of the respondents were female and 37% were male. Female respondents were significantly younger, more racially and ethnically diverse, and at an earlier point in their career than male respondents. Overall, 64% of study participants reported experiencing some form of sexual harassment on at least one occasion during either training or in their years of practice. For female respondents, the frequency was 71% and 51% for male respondents. Data about harassment experienced by respondents during their training and during their years of practice were similar. During their years of practice, over 50% of female and over 20% of male respondents reported being subjected to offensive sexist remarks. Of particular concern is that more aggressive harassing behaviors that imply sexual contact were reported by a subset of respondents of all gender. 30% of all respondents had been subjected to unwanted sexual advances. An additional 3% of all respondents reported being asked to exchange sexual favors for academic positions. Although more female than male respondents reported perceived gender discrimination, including being denied opportunities for rewards or receiving lower academic positions due to their gender, it is notable that nearly 20% of male respondents also reported perceived gender discrimination in their careers. Of those that experienced some form of sexual harassment, only 14.5% reported the behavior. Study participants were also asked about their perception of gender disparities in their careers. Of the 402 study respondents, 34% of female and 70% of male respondents reported no obstacles to advancement in their career. Of those respondents that reported factors affecting career advancement, both female and males commonly chose gender as a factor affecting their career advancement. Female respondents also chose being the primary caretaker of children, while male respondents chose race or ethnicity. Study participants were asked about perceptions regarding gender and salary. 36% of female and 81% of male respondents felt that gender did not play a role in determining their salary. In regards to income, 57% of female respondents felt that there was no gender pay disparity. This is compared to 91% of male respondents. In conclusion, our study notes that in this population, experiences of sexual harassment are common and reported by all genders. Of concern is that more aggressive sexual harassing behaviors that imply sexual contact were also frequently reported. Unfortunately, very few respondents reported the harassing behaviors. In regards to gender discrimination, while we've shown that female respondents were more likely to report instances of perceived gender discrimination, nearly 20% of male respondents also reported experiencing gender discrimination in their careers. In regards to career advancement and income, more male than female respondents felt that they had no obstacles to advancement in their careers. Also of interest, 91% of male respondents and 57% of female respondents felt that there is no gender pay difference. Our study sheds a light on experiences of sexual harassment and gender disparities, and future work should focus on interventions that address these issues. Thank you for your attention.
Well, there's some eye-opening findings, so I'd like to ask Dr. Markham to make some additional comments about this study.
Thank you. I think we all know that sexual harassment is a societal issue, and the Me Too movement has really raised awareness of this on probably a global level. We have more and more data coming out raising awareness that this is also an issue for many women, and as this study points out, some men as well in medicine. The Time's Up healthcare movement is designed to raise awareness of this issue, specifically as it focuses on sexual harassment and gender disparity affecting women. I think it's important that we're having these conversations. I think the only way that we're going to move forward is to continue to have discussions about the facts. Dr. Stasinsko's study is very important as it gives us more data to show us where the problems are. The ultimate goal should be gender equality, should be equality in the workplace, regardless of gender. We need to do all that we can to eliminate disparities and to obviously eliminate as much as possible this issue of sexual harassment that clearly affects both genders, but primarily women.
Thanks.